My name is Miroslav Hajicek. I'm a pediatric rheumatologist and full professor of pediatrics at Medical School of Zagreb. In the past, I have successfully completed several scientific and technology projects.
My name is Hrvoje Pintarić. I'm an interventional cardiologist, professor of internal medicine at University of Zagreb, Croatia.
Hello, my name is Boris Devic. I am a veteran of 25 years in Silicon Valley.
The principal unmet need a TriCor device and service package solves is access to reliable and immediate advanced cardiac alerts and diagnostics. Chest pain can be a sign of a heart attack or other cardiac condition, but it can also be a symptom of problems related to respiration, digestion, and other conditions. A blockage in the heart blood vessels that reduces blood flow and oxygen to the heart muscle itself is the most common cause of death worldwide. Acute myocardial infarction is associated with a 30% mortality rate. About 50% of deaths occur prior to arrival to the hospital. Access to a relevant diagnostic tool in the initial evaluation and triage of patients in whom an acute coronary syndrome is suspected makes a quantifiable difference in outcomes. Possibly the most lethal situation an individual can find themselves in is a serious heart condition without any immediately discernible pain or discomfort, and it's called silent angina. The absence of timely health alert and consequent diagnosis result in a very high percentage in sudden cardiac deaths. Early detection of risk factors and thus prevention of cardiovascular deterioration is an additional benefit of the TriCor package for a much broader group. Persons with arterial hypertension, persons with hyperlipidemia, persons with diabetes mellitus, smokers, existing post-stroke and post-myocardial infarction patients, in heart transplant patients, persons who engage in intensive sports and physical activities, professionals exposed to combat stress. Hypertension is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. Hypertension is a major cause of premature death worldwide.
The TriCor package consists of three logical layers. The first layer is a TriCor box, which houses all the sensor electronics. It is controlled by a very sophisticated microcontroller, which collects all the data, amplifies all the signals, and then sends them by wireless connection to the consumer device. The consumer device is usually a phone or tablet. The cloud layer is responsible for sophisticated analysis, which is done through machine learning and artificial intelligence algorithms, and it is used to produce alerts and health warnings.
TriCor users will have a reliable medical-grade wearable device that will help them in assessing increasing cardiovascular risks, potential acute events, and will suggest either to see a physician immediately or make necessary lifestyle adjustments.
TriCor applied to the Wildcard initiative because it sees value in bringing important diagnostic and prognostic advances to the broad public at affordable consumer price. What tipped us over to consider going public after years of research was the convergence of several enabling technologies in the price space, which makes a new approach to health accessible to the general public in the developed market, as well to the professionals in the countries with a high patient-to-physician ratio. What are the value propositions of TriCor? Primarily, professional-grade diagnostics, monitoring and follow-up services at a consumer price point. Secondarily, broadening access to cardio health care, specifically in places with limited budget and high patient-to-physician ratio. And finally, bringing advanced diagnostics to locations where standard healthcare facilities are feasible logistically, financially, or both. We will use technologies that are not widely available to consumers, namely using sensors for determination of brachial ankle pulse velocity that was scientifically proven to effectively estimate the level of blood vessel rigidity and of atherosclerosis. In addition, instead of using standard ECG, we would use 5-lead textile-embedded cardiogoniometry that is a 10% more sensitive than standard 12-lead ECG. By using the same set of peripheral sensors and advanced algorithms for cardiac cycle phase analysis, we'll be able also to determine client's blood pressure, pulse oximetry, which is the oxygen saturation of the blood, and non-invasive lactate levels as a reliable biomarker of cardiac fatigue. These various biological inputs will create a variable space for each user and groups of users as well, which will lend itself to analysis by predictive machine learning and artificial intelligence algorithms running in the cloud. The market potential for the TriCor device is global. Predicted revenues in wearable segment amounts to $2.5 trillion in 2020, with an annual growth rate estimated of 2.7%, with the user penetration expected to be 5.1% in 2020. A modular design will allow us to fully customize the device for clients' needs, sex, and body sizes, through an exclusive online shop. The TriCor device and the services will be sold either directly to individual customers or organizations with a specific healthcare needs. All collected, real-time, raw data will be properly anonymized and, as such, interesting to organizations and companies whose primary goal is to improve the cardiac health of EU citizens.